J'ai le grand plaisir d'être ici aujourd'hui pour cette présentation, and my thanks to Louise for inviting me. Apologies that I'm not delivering en français, but you have translations in French of the slides, and they are available. So maybe just to start, I'm going to focus on promoting population, mental health and well-being for children and youth. So just wanted to see how many people here today actually work in the area of mental health promotion, population health. Okay, so I know, yeah. Okay, and how many of you work with young people in relation to public health promotion? Okay, so I will cover some of the basics as well for those of you who don't work in this area, but I want to look at innovative approaches to policy, to practice and research, and sort of give you an overview of where we are in relation to this from an international perspective. And maybe look a little bit at how we frame the challenge of improving youth mental health and well-being. Often it's framed in terms of providing better access to services, etc. But I think we need to reframe that, and we need more innovative policies and practice approaches, particularly in relation to embracing upstream interventions. There's a lot of focus on maybe looking at the individual and one-to-one approaches, but looking very clearly at prevention and at promotion and what that means and how we do it. And particularly how we engage with other sectors in terms of delivering on a whole of government and a whole of society approach, and exploring new delivery platforms for doing that in the area of mental health promotion. So that's what I plan to cover. So firstly, when we look at youth mental health and well-being, I think young people today probably have unprecedented opportunities. This is true. But I think there are also unprecedented challenges. You know, we live in a very kind of fast-paced, complex, competitive world. And I think from a kind of social, cultural, economic and environmental point of view, the range of factors and the challenges are very different to the world that I grew up in. And so for young people to really succeed in life and to develop positively, they really need quite a broad range of skills, cognitive, social and emotional skills for successful development. We know that in many high-income countries, including the European Union region where I live, that we have seen increases in youth poverty, particularly over the last 15 years. For example, countries like Spain have up to 50% unemployment rates for young people. Now, that's a massive impact. We have also seen quite the migration issue for young people being dislocated from their countries, coming into new countries, and the challenges that bring, young people being displaced as a result of war or conflict or for economic reasons. Very challenging to look at that whole adjustment process. And we have seen, in parallel with this, rising levels of mental health problems, and we have seen youth suicide. In my own country, youth suicide is the leading cause of death for young men, as it is in Finland. And countries like Greece, which traditionally had very low levels, have seen a 50% increase during the period of economic austerity. So these social challenges are very much reflected in the challenges that are presented to young people. And we also know that disadvantaged and minority youth are affected disproportionately with poorer social, academic and mental health outcomes. So what is to do? How do we speak to that challenge? It is clear that promoting youth mental health is a critical strategy for improving population health and well-being. Mental health, there is no health without mental health, so we need to bear that in mind. But also that it contributes to social and economic development. The youth are the future, right? So if we have young people who are disenfranchised, no possibility of employment, this does not augur well for social and economic development. Neither does it augur very well for social cohesion. So it is a critical part of that agenda. And so this is why I think that when we look at promoting youth mental health, we need to look at new ways of doing that, innovative approaches. And we've seen a lot of focus on this within the health systems, the importance of innovations, looking at new models of service provision, new technologies, new ways of doing things that will lead to improved quality, equity, and resilience of health systems. I sit on an expert panel on effective ways of investing in health at the European Commission, and there are 14 sort of independent scientific members on that, and we were asked to produce an opinion on disruptive innovations in health. Now, I don't know if you're familiar with that concept of disruptive innovation, but it comes from the business world, and particularly the work of Christensen et al. From Harvard, and it looks at disruptive innovations are new ways of doing things that lead to improved outcomes that are more accessible at a much lower cost in terms of service and products. So the classic thing would be the mobile phone. Look at the massive, it disrupts, completely disorders the old system, but leads to more accessibility at lower cost. The personal computer is another example. And so it's essentially a paradigm shift that leads to transformational change. And there's a lot of interest within health systems to look at how innovations can happen within health that will completely change how we do things and improve population health. Now, I would argue, and we argued in this opinion, that when health promotion arrived on the scene in public health, that it was a disruptive, and it had the potential to be a disruptive innovation. So here, when the Ottawa Charter came out in 1986, it brought a new way of thinking about health. First of all, it talked about health, not illness, and it looked at how we promote and keep people healthy. So it had all of the characteristics, I think, to be a disruptive innovation. However, it has not been given the oxygen that it needs for that to truly transform our health systems. You only need to look at the budgets for public health to realise, why that's the case. But if we look in terms of our non-communicable diseases, so if we look at cancer, for example, we know from a public health perspective that yes, we need improved treatment and improved diagnostic tools and treatments. But if we look at lung cancer, looking at addressing the causes of the causes, using techniques like legislation on tobacco control to effect change, much more effective than trying to persuade people one at a time to give up smoking. Okay, so it's a new, bringing in new strategies to address problems. The same in terms of cardiovascular disease. So looking at shifting towards promotion and prevention alongside improved and more accessible treatment, because the treatment on its own will not be sufficient to bring about the population level change that's required. So this type of thinking has been slower to come to the area of mental health, but it is there, and the World Health Organization have embraced this. In 2002, they put forward one of their early documents on the importance of promotion and prevention in relation to population mental health. And in 2013, their global mental health strategy very much reinforces that and endorses the need for a comprehensive approach embracing promotion and prevention alongside treatment and recovery. It's not an either or. We need a comprehensive approach because there's a recognition here that if we continue, there will never be enough clinical interventions to meet the demand on a one-to-one basis. So this kind of paradigm change in thinking about mental health has kind of slowly taken root. Most people, when you say mental health, and I don't know what you thought when you saw the title, but most people think of mental ill health. Okay. So this is saying we have to focus on the health end of this continuum rather than just on the illness end. We need strategies for creating the greatest mental health gain for the greatest number of young people. So it aligns us much more closely with positive development. And also we have to shift from a deficit model of illness and trying to address the deficits to looking at the health potential of young people and, importantly, the health potential of the everyday settings in which they live their lives. So it takes us into a completely different space and area. So health, is not created in clinics and hospitals. It's created in our homes, in our communities, in our schools. It's also damaged there. So this is the same is true for mental health. So this is what I mean when I talk about reframing the challenge of improving youth mental health. So essentially, we're adopting a health promotion approach which says we need to look at a social model of mental health and the social determinants of mental health. And for so long, mental health has been seen as a kind of property of the psychology of the individual or the biochemistry of the individual, and not recognizing that these broad social determinants are really influential. It means we have to bring in perspectives from outside of the mental health area. There are new players and actors from the non-health sector that have a major influence and a major role to play. And it also places like empowered young people and their families at the center of their own mental health. And that is really important. And we need comprehensive multi-level interventions. So essentially it's shifting away from, clinical and biomedical interventions to a system-based approaches that can be implemented at a population-wide level. So to those of you in public health, this is not new. But in mental health, this is bringing in a new approach. So I just wanted to, I quite like, this is an old diagram, but it's a good one. It comes from Australia, and it was produced in the 90s when they were looking at building capacity to promote the mental health of Australians. And it gives us a very good overview of where promotion and prevention sits alongside treatment and recovery within our mental health services. So if we look at starting over at this end, our classic mental health services are mental ill health services. So they're concerned with populations with diagnosed disorders, be it anxiety, depression, and other conditions. And it's looking at effective treatment and recovery and optimal management and care. So that's the core business of most of our mental health services. Here we have populations with symptoms, so it may be early signs of depression, etc. We're looking at early diagnosis and intervention and appropriate identification. That's classically our primary care services. When we look at populations at risk, when groups are going through particularly stressful periods or at certain life stages, they are at higher risk. Prevention looks to reduce avoidable risks and looks to prevent anxiety, depression disorders and other related problems. And when we come to promotion then, we're looking at populations that are, in inverted commas, healthy. They haven't got any early signs or symptoms. They haven't got diagnosed problems at the moment. And the challenge there is to build resilience, to maintain healthy lifestyles and to create healthy environments to support and maintain their health. So that's the health promotion. So within mental health, this is the continuum that we are aiming to have, so that we address all of these, and so these are the areas that need to be developed, right? Because they will also enhance, I think, the delivery of the treatment and the recovery. So the challenge becomes creating environments for optimal development, good mental health and resilience. That is the challenge. And when we look at the WHO, the current global strategy on mental health, it recognised very clearly the importance of promoting what we call positive mental health or good mental health and enhancing social and emotional well-being across the lifespan. This is a core strategy that has to be there in order to bring about improved population mental health. It is interesting that organisations like the OECD, the Organisation for Economic and Cooperation and Development, in their 2015 report, Skills for Social Progress, they focused on social and emotional skills development as a key asset and a resource for young people, recognising that it was key for the development of life skills. Because they recognise this is important for all aspects of social progress. So that was quite interesting that those organisations are now working also on these areas. We also know that the early years lay the foundation for good mental health across the life cycle. This is very important. And we know that, like health itself, mental health is created where people live their lives. So what we are seeing is a kind of a broadening out of our understanding of what constitutes good mental health and how it can be promoted. So mental health then is now being conceptualised in a much more positive way, as a positive resource and an asset, and that's reflected in the WHO definition, which clearly sees mental health as a state of emotional and social well-being, where the individual realises his or her abilities. It's about managing the normal stresses of life, working effectively and playing a role in one's community. So we all have mental health needs. Okay, we all need mental health promotion because all of us need this. We have also seen renewed interest in sort of articulating concepts of what is positive mental health. There's been, further research done on that. When I was a student, I only came across, I was interested even then, and I looked, and I only found one text from 1956 that looked at what might constitute good mental health. Most of it was about poor mental health and problems. Researchers like Corey Keyes from Emory, Felicia Huppert from Cambridge, Carl Riff, and the positive psychologists, they're starting to look at what is good mental health, how do we define that, what are the characteristics, and doing further research around it. So looking at subjective well-being and life satisfaction combined with positive functioning, engagement and social well-being, and what are the factors that contribute to that and make it possible. So there's a whole body of research that's come forward in the last 20 to 30 years that wasn't there before. And I think Corey Key's concept of flourishing, I'm not sure what word that was translated into in French, but it has captured the imagination. I mean, who doesn't want to flourish? Yeah. And it at a policy level, it has also captured the imagination because it is now appearing on policy documents. And it's very much about the ability, the rounded development to develop psychologically, physically, emotionally, intellectually, socially and spiritually. And from my reading of it, this looks very close to the indigenous wellness frameworks, about a sense of balance and harmony between these developments. Yeah, these aspects of development. So I think that's quite interesting. Another interesting document here that came out in 2014 was produced by the WHO and the Gulbenkian Foundation, and the work was by Professor Michael Marmot and his team in London, building on the work that had been done for the WHO Commission on the Social Determinants of Health, which I'm sure you're all aware of, looking at social determinants of mental health. And one of the key messages from this report was that mental health and many common mental disorders like anxiety and depression are shaped to a great extent by the social, economic and physical environments in which people live. And I think that knowledge has been underestimated because we have consistently focused on the psychology of the individual, their thinking strategies, rather than looking at what are their conditions of everyday life and how that impacts on mental health. So essentially, the report called for actions to improve the conditions of daily life, because you will then help improve the factors contributing to good mental health, and called for a whole of government and a whole of society approach where we have universal actions, because it needs to be universal because we all have mental health needs, and across the life course engaging multiple sectors and at multiple levels. So it's an interesting report in terms of saying that policy making at all levels of governance and across sectors have a role to play and can really make a positive difference to mental health outcomes. So here, from the disruptive innovation point of view, these are the new players and actors that need to be brought into this area, because the majority of the determinants of mental health are way beyond the health sector and certainly way beyond the mental health services. Right? So this is opening it up in terms of who's going to play a part. So addressing the social determinants of mental health, therefore, we need to see how we can strengthen individuals and families, looking at social and emotional skills development, resilience, coping, but also strengthening communities, social support, sense of connectedness and social inclusion, social participation, reorienting our health services to promotion and prevention as well as treatment and rehabilitation, and removing structural barriers to mental health at a societal level, be that cultural, economic and social policies that impact on mental health. And we refer to this as mental health in all policies approach. Okay, so that it's the health in all policies with a mental health focus. So here we have, this is the classic health promotion framework. And this is where we say this is the framework we also need to bring to mental health. So we're looking at a socio-ecological model where we look at the individual in the context of their community, in the context of the larger environment, and the policies that are regulating and shaping that. And that we need combined action at each of the 5 levels from the Ottawa Charter to really bring about change. So it's a systems based approach. So we don't just focus here, right? We need from the micro to the macro. And if they work together, then we can really see and affect change. The top half of this figure was produced by the Institute of Medicine in the US in the late 90s, Mrazek and Haggerty, and they looked at where prevention sits in relation to treatment and maintenance for mental health. So you can see here the classic case identification is treatment, and over here then you have like the aftercare and the rehabilitation. So here prevention obviously comes before treatment, so you have universal prevention, which from public health you know. Selective is looking at for individuals at higher risk or communities at higher risk, and then indicated is when there are early signs and symptoms and looking at approaching there. So at the time I was a little audacious in taking this and saying I want to finish this off, I want to put a circle, and I want to put mental health promotion here because this is the bigger part of it. How do we keep the sort of healthy population healthy? And you can see there is a kind of, quite an overlap between universal prevention and promotion. And there's also quite an overlap between recovery, rehabilitation and promotion because people pass through the system here. And when they come down here, you want to try and keep them in this territory for as long as you can. Okay? And so this is the sense then that we have promotion, prevention, treatment and rehabilitation that work together, and we need to invest in that. Is that okay? So there we have the kind of frameworks, but also we have seen in the last 30 years quite a bit of emphasis in gathering the evidence to support actions in relation to promotion and prevention. We now have fairly compelling evidence internationally that mental health promotion and primary prevention interventions reduce the risk factors for mental and behavioural disorders. They enhance protective factors for good mental health and well-being, and can also lead to lasting positive effects on a range of social and economic outcomes, be that academic performance for young people, employment, social functioning and health. So the evidence is there to support that. So we have a convincing social and economic case for investing in the promotion of youth mental health and well-being. The policy frameworks, our current global action plan from WHO talks very clearly about comprehensive strategies adopting a whole of government approach, protecting and promoting the mental well-being of all of the population, taking that approach, and then that the responsibility extends across all sectors and all government departments. So this is new. This is new for them, that other departments outside of health have a key responsibility here. So it's looking at how we mainstream mental health into public health, into poverty reduction, economic development and our social policies. This builds very much on the Helsinki Statement on Health in All Policies, which I presume most of you are familiar with, which means that policymakers have to be accountable for the health impacts of their policy making. And we need to bring mental health into that, because when they talk about health impacts, very often it's physical health, not mental health. We also, the Shanghai Declaration mental health and well-being got in there just about. If you look at SDG 3.4, it explicitly mentions, it's ensuring healthy lives and promoting well-being across all ages, including promoting mental health and well-being. So that's in terms of sustainable development goals and the relevance of population mental health for that. So our whole of government approach looks at positioning mental health and well-being way beyond the sphere of psychology into the political, economic and social sphere, because they are the factors that influence it. Governance is a priority for more than the mental health sector, and this calls for policy coherence, so that we have maybe one department looking at policies like that would promote mental health, and then you have other policies that undermine it, right? So how does that get reconciled? And certainly if we want to address the social determinants of mental health and look at mental health inequities, this requires intersectoral action, participatory policy approaches, and it requires quite a bit of leadership, both from top down and bottom up, actually, to make that happen. The whole of society looks at enabling control and agency and empowering individuals and communities in relation to their own mental health. Most people recognise that mental health is really important, but often there is a kind of a lack of understanding of how to do that and what can be done. So it's engaging a much wider set of actors for intersectoral action. The obvious ones would be childcare and education, but also welfare, youth services, housing. Living in poor housing is really detrimental to mental health. Employment and justice, and how these policies impact on mental health. And I do think that when we talk about social and emotional well-being, that the language of well-being opens the door to more actors than the language of mental health. Because when we talk about, social inclusion and a flourishing society, yes, there's a lot more actors that see, yes, we have a role to play in this, be it arts and culture, sports, urban design, local authorities, etc. Media. So it's the participation of the wider community, including young people themselves, in creating the conditions for well-being and positive mental health. So we're talking about ensuring access to life opportunities, essentially. That means having supportive relationships, because we know from research this is really important for good mental health, access to good education, employment, income, housing and social inclusion. And it means removing the barriers that come with social inequity, injustice, experiencing poverty on a daily basis, stigma and discrimination, because they deny access to life opportunities. So that means we have to work across sectors to implement mental health promotion actions. And I just want to bring attention to a document produced by the National Collaborating Centres for Public Health, and Pascal and her colleagues are here, that came out earlier this year. It's a collection of papers looking at how public health and looking at the role of public health in relation to mental health promotion, how an increased understanding of positive mental health and how it can be integrated into public health practice. So I would encourage you to look at this. There's a foundation document in 6 papers looking at how public health can integrate with that. So please do consult that on the NCC's webpage. Okay, so I want to talk a bit now about the evidence for these kind of approaches, whole of government, whole of society. What evidence do we have around interventions? What do we know about what works? Not only does it work, but is it cost effective? Is it culturally appropriate? If there's work done in North America, will it travel to other parts of the world? Is it feasible? The equity impact. Are the interventions, will they be effective for diverse population groups? Have we got implementation guidance? Actually taking it and putting it into practice, what kind of technical skills, what kind of resources and capacity, what kind of systems changes are required to support that. And also in terms of context, like, will this really work under the messiness of real life conditions as opposed to a research project? This is a big, and also in terms of across diverse sociocultural contexts, So really bridging the science to practice gap, really very important. We have done in our WHO Collaborating Centre quite a bit of work with WHO, myself and my team, looking at synthesizing the evidence, the international evidence, and what we should take out of that in terms of, if you want to invest, go with these actions. So the first one there was an evidence brief that I did with my colleague Alicia Clark and Professor Inga Peterson from South Africa. We did it actually for the implementing the global mental health action plan in the Eastern Mediterranean region, which is an interesting region because it has very high income, middle income and low income countries. So they wanted us to review the evidence about what would work across not just the high income countries but the low income countries. And we also, with Rachel Jenkins and Vikram Patel, we also did a systematic review for WHO Geneva, looking particularly at low and middle income countries and the evidence for young people in relation to that. These two then are more focused on high income countries. This was a review that we did with the International Union for Health Promotion and Education, Marie-Claude will remember this, and the Picardy Regional Health Agency in France. And they wanted to look at enhancing psychosocial skills development for young people. So clearly we drew on the evidence from high income countries for that region, as we did here for the UK government in relation to their work. And so, you know, you're really drawing on the evidence that's there, really pulling out what we know works. And we're currently I'm currently updating this text, Implementing Mental Health Promotion, where we review the evidence and we look at case studies of implementation across different settings. We're currently working on that and hope to have a second edition out next year. Another type of review that we have done, this is slightly different because often you review the literature and then you make recommendations. Here, the Early Intervention Foundation in the UK and the UK Cabinet Office wanted us to review what was happening in schools and in community sectors, like what's going on and what is the evidence for that work. So we were looking at current practice and then looking at the evidence. So that was quite an interesting review because it was different from starting with the literature and drawing it out. But essentially, if you look at that, I think we would highlight that there are kind of priority actions where we have fairly solid evidence across high resource and low resource conditions. So the first one is early childhood interventions from 0 to 3, including home visiting, parenting and family support. And these are essentially about integrating social and emotional development into routine antenatal and postnatal care and home visiting programs where the nurses typically go and visit parents in their home for the first year to 2 years of the child's life, empowering parents and enhancing emotional well-being of both the children and usually the mothers, right? The second is on preschool education and community-based parenting, where again, preschool education typically looks at, you know, children's readiness for school in terms of their cognitive development, but also here integrating social and emotional skills development into that. And the final one here is school-based approaches, where we have fairly robust evidence at this stage on the importance of social and emotional learning, universal programs in schools, implemented within a whole school context, and targeted interventions for more vulnerable children. So these are maybe the three kind of priority areas. Now, time is running short, so I'm not going to be able to go into a lot of the detail. I've pulled out a few of the classic studies here because there's a lot of studies. This is a classic study with over 30 years of research behind it from the Nurse Family Partnership Programme, which looks at home visiting for young women having their first child. They're low income, at-risk pregnant women. The trajectory doesn't look good for them or for their children, and it comes with a very structured protocol, a strengths-based approach, and it starts prenatally and it goes up to 2 years. There's a lot of research behind it where they have followed up the children who have been in receipt of this particular approach, and you can see there the impacts. They're quite, you know, the impacts on child abuse and neglect, on family planning, on the mother's own behaviour and in relation to alcohol and drug use, and also in relation to the children themselves doing much better. This particular programme, they've also looked at the cost-benefit analysis, and the cost of the programme in the 90s when it was developed was just over 3,000 per family, and so the big issue is, can we all afford this? So again, the costs are recovered by the child's 4th birthday. The savings are 4 times the original by the age of 15, They're, in fact, now the long-term estimates is that they're up to 23 to 1. So for every dollar that's invested, there's a 23-fold return. So this is and this program's been replicated throughout the US. It's also been replicated in countries outside of the US. So there's really strong evidence on any ground that this is worth investing in. Also other programs, I've only mentioned a few here, Triple P, Positive Parenting, Incredible Years. Preschool, the same. We have long-term benefits from preschool education that builds in a focus on social and emotional development of young children. This classic study here followed children up to 45 years, and you can see they're doing better in terms of school success, employment, their own lives. And again, the cost-benefit analysis is a $17 return for every dollar invested. So this again has now been replicated on a very large scale. Head Start Ready in the US and the Sure Start programs in the UK. In terms of schools, again, a lot of evidence, and there's an increased recognition in education that we build academic success on social and emotional competence. That is really very important for children to have these essential skills in terms of being able to learn. So self-awareness, self-management, social awareness, relationship skills, and responsible decision making. They're skills for life. And the evidence is there to support the fact that these social and emotional learning programs lead to very significant impacts in terms of a wide range of behaviours, conduct problems, emotional disorders, but very particularly from the point of view of education, they improve academic learning up to 11 percentile higher on standard tests. Now, education are impressed when they hear that, and also that it will reduce conduct problems. So we have very strong evidence now from those reviews. The out-of-school setting, the evidence is not as robust, but there is a lot of innovative action and programs, but the evaluation studies are weaker, but I think the potential is huge in relation to out-of-school interventions, looking at the youth sector and engagement of community. The same is true in relation to online technologies. There's an emerging evidence base here. It's quite strong in relation to using online technologies for example, anxiety and depression, like computerized cognitive behavior therapy. But we reviewed the evidence in relation to promotion and prevention. And here, the sample sizes are quite small, the study designs are not as strong, but there is some promising evidence from these programs, like gaming interventions. One issue I would say is that the dropout rate from these is very high, and often it is the most vulnerable young people who drop out. So this is an issue about how we harness this and use it most effectively for those young children who need it most. And also we have an issue about the digital literacy of adults who are working with young people in terms of their comfort in facilitating this. So I want to try and kind of wrap up. So we have a lot of evidence, but we need the policy measures to embed these. It's not about once-off programs. It has to be about integrating them into standard delivery. So we cannot talk about childcare if we don't actually have a universal childcare system. We can't talk about preschool if it's not accessible to everybody. You know what I mean? So you can't integrate into a system that's not there. So that is really, really important. I'll just skip that actually. So engaging young people is going to be vital in this because they have a key role to play and they want a role to play in their own mental health and well-being. And I think it's also about broadening our concept of, you know, this notion of mental health literacy, what it means. It's more than recognising signs and symptoms of distress. It's recognising how you protect your own mental health, recognising the importance of how social values and culture impact on your mental health. And it's also about organisations like schools and communities, youth settings, being much more mental health literate. And that's a bigger undertaking than just simply telling them about the signs and symptoms of depression or anxiety. So to finish, we're talking about investing in policies and practice that would deliver at a population level. Scaling up and integrated what we know works based on cross-sectoral planning, working with education and other sectors. But we have to have a policy mandate for that to happen and to support that. It's also about strengthening implementation. We need systems and support structures to enable implementation effective implementation at the local level. And the delivery mechanisms have to be there. You can't embed mental health into if there isn't a delivery mechanism already there. And I think key, is also having the organisational capacity to engage with this, and having the workforce with the right mix of skills and knowledge to enable. It won't happen by itself. We need a much broader mix of skills than just mental health specialists have. And we need to look at mobilising and engaging young people, working in partnership. And I would also say, we haven't had much time to talk about this, we also need new research paradigms, because if we are talking about innovative practice, we will also that involve systems-based change. We will need new ways of measuring and capturing that. Our traditional RCTs that constitute our evidence do not handle this very well. Okay, they cannot capture that. Change is not a linear process when you're working at a settings level. And I think we will need much more transdisciplinary perspectives and improved translational research. So apologies for the rush at the end, but I ran out of time, so I will leave it there, and thank you for your attention.